So I brought out our Dr. Devi on the show to break this down for us.
So let's go right now to Dr. Devi at CNN New York for more. She's an assistant professor at the New York University School of Medicine.
Dr. Devi, not be a pill, is an interventional pain specialist.
My main concern is about patient care. So normally the system is set up where the doctor, the pharmacist, and the patient are on the same side, trying to improve patient care. In this case, the doctor and the pharmacist may be on opposite sides and the patient may be stuck in the middle.
Yeah.
The importance of those last 2 years of medical school is that people learn about other fields of medicine. So they learn about the things that they're not going into.
Dr. Devi, do you agree or disagree?
I agree. I actually think these problems with the website are a sign of a larger problem. The system is getting overloaded because so many people are trying to sign up for healthcare. The same thing could happen with the medical system. So many people are trying to get in to see the doctor even today.
What's the downside and what do people say about their privacy?
Well, privacy is one thing. So we really try to emphasize to people that this is still a medical visit and they have to respect other people's privacy and not share any of the information outside of the group. There are cuts to the NIH and other federal funding. I mean, we can give people health insurance, but unless we make advances in terms of our technology, our knowledge, our application of that knowledge, patients are not going to benefit in the long term.
I want to pick my doctor.
Exactly.
I want to. What kind of doctor are you?
I'm pain management as well.
But there are days when my pain is at its worst, and I need some quick relief. That's when I take these pain patches I want to share with you. Dr. Devi, not be a parent pill. The most difficult last name I've ever said on the show before is interventional pain management specialist, and you're going to teach us more about this cutting-edge therapy. So how do these work?
Well, a patch is a storage device. So the way to think about it is that it's storing medication and it's delivering it directly to the area where there's pain. So it's nice because if you have shoulder pain, you can just put the patch on that area and the medication goes through the skin to the deeper tissues.
Let me show everybody the recent experience I had. Here's my patch, what mine looks like. You see there's a little bit of a battery on the top of it.
Now, the prescription ones can have different substances in it. So the prescription ones can have local anesthetic, similar to what you get when you go in for a dental procedure. And then, like the one that you use, it has cortisone in it, which helps also fight inflammation. And the battery power can help deliver that drug in a little deeper and a little faster. Every medication has potential to cause harm or potential side effects. And at the same time, if you avoid all medications, that also has a risk. Somebody's drinking large amounts of coffee because they never get any sleep. I think that's a bigger thing to look at than actually the number of cups that they're drinking.
So what are the biggest warning signs, Debbie, that if someone has taken too much acetaminophen?
You're looking for signs of liver damage.
I want to bring in here in New York, Dr. Devi is with me.
Right now, they have enough information to find people who have severe brain injuries or spinal cord injuries, but the milder ones take some time to develop. The blast wave can cause the air inside the organs to move as well, and people can have injuries related to that. If these cases keep popping up, let's say from March until now, that means that the bacteria continues to live. So people who are coming to the campus for Thanksgiving or people who are leaving the campus around Thanksgiving time could spread it to other places. So it's important to try to vaccinate people so that at least they don't carry the bacteria elsewhere. They don't get infected with it and spread it even faster. If you get it in the nose, it can travel up through the nerves that give us our sense of smell, and it basically gets to the brain that way. Well, Botox works for wrinkles and cosmetic procedures the same way that it works for chronic migraine. It weakens the muscle. So the medication I'm going to inject is actually going into the trapezius muscle right now. So big pinch here. A lot of burning. We're partners, so if you feel any lightheadedness, dizziness, nausea, or anything, just tell me, okay?
Okay.
All right.
How long will it take for this to be effective?
It takes about a week for the medication to kick in, a little bit more cold soap here. So if it's helpful for Teresa...
the first time.
Yes, thank you.
If it's helpful for Teresa, then we can always repeat it. So,
This could have cosmetic benefits too.
well, that's one of the side effects, that you might get rid of wrinkles.
At least you won't frown when you have migraine headaches.
That's right.
From a practical perspective, though, it doesn't make sense to ban football. It's important for us not to create a panic. We're really talking about medical marijuana, whether it's safe or effective for people's health. That's a different issue than the legalization of marijuana for recreational use or social use. But we don't know about the short-term and long-term effects of marijuana as well. Although we have some studies, it's not really studied in detail because it's been illegal. Most people with cystic fibrosis are predisposed to getting infections, especially lung infections or sinus infections. And so what happens is they tend to get exposed to a lot of different bacteria over time, and with different antibiotics, they develop resistance.
to a lot of them and develop more dangerous bacteria.
We have a little bit of time here and ask you something that I didn't speak to you about, but it's something I read about in the New York Times.
Okay.
If you don't know, we're just talking.
Sure.
There was this, there is this strain of meningitis that has been going around, as you see that, and they're inoculating gay men in clubs over in the New York Times. What is going on with that? They're saying, oh my gosh, this is, people are wondering if this is going to be like AIDS back in the 1980s.
Well, the thing with AIDS in the 80s is that people didn't know what was happening, and there was a lot of stigma associated with it. In this case, meningitis has been around for a long time. This is a new strain that we're hearing about, so there is some concern for that. But the vaccine is recommended not only for gay men, but also for children, for teenagers, adolescents. So we shouldn't have that stigma, but it is important for people to get treated.
The doctor is in to explain